Hey everybody, and welcome back. If you are new to this channel, my name is Dr. Span, and I am a licensed PT in the state of Florida. I specialize in educating, preventing, and treating patients with or at risk of chronic kidney disease. On today's episode, we are going to talk about two major health conditions: cancer and chronic kidney disease. And guess what? We have a special guest, and you are going to love her. She is smart. She is funny. She is the most kind and loving person that I know. She is an oncology nurse with a year of experience. And let's not forget, she's one of my dearest friends. I welcome to you, Mya Gibbons. So let's get right into it.
Let's do it.
Mya, can you explain to everyone what oncology is?
Oncology is a sector in medicine that is the study, diagnosis, treatment, and prevention of cancer.
All right. Can you now tell us a little bit about how nursing plays a part in cancer care?
Nursing plays a part in cancer care, mostly dealing with support. I feel like a lot of nurses have to support their patients because you have some patients that are just finding out or newly diagnosed with cancer and they don't know how to control their emotions or their feelings. You have some patients that are completely abandoned. They don't have any family to come and visit. And honestly, and I'll go into a short story. I just recently had a patient who had head and neck cancer. And so she had to get a reconstructive surgery, which means like her jawbone, all of this was gone. And she contacted MRSA, which is like a viral infection. And now you have, not only are the family not showing up because they just don't have time, but now they have a definite reason. Like, oh, I don't want to go because you have some viral infection that I don't want to catch. And, you know, and just the task of putting on the precaution wear, the PPE in order to go into the room, that's a lot, you know. And I cried for her because she was someone, being that she had that surgery, she's not able to talk. So she has to write everything down, and God forbid we have to go, or she's moving too slow for us. She has to speed, and she has a whole plethora of words that's being heard every single day that she doesn't know, that she has to learn and adjust to in order to communicate properly with us. And one day I went home and I cried because I'm like, wow, you know, she's learning so much just by being a patient.
Right.
And to put yourself in her shoes, you know, you gain more patience, you gain empathy with somebody to just, I don't know, to do your job. And I think outside of the vocabulary, outside of giving medicine, outside of just doing the tasks that you have to do or following orders that the doctors give you, you have to be able to support somebody. You have to be able to be there because they don't have anyone.
Yeah. I did my research on, the part that nurses play in cancer. And like one of the first things that came up was you guys being that support system for them.
Yeah.
And I guess in my mind, not being a nurse, I think you guys are there to, make sure they're alive, basically, checking their vitals, giving them their medication. But I never physically thought about, these people are here to comfort them.
Right.
These people are here to just give them that love, like when their family goes home.
Yeah.
So it really makes me respect you and what you do, because that people need that, especially in those times.
Thank you so much. Thank you. So being in oncology, I see a lot of patients that are getting chemotherapy, and being that medicine is so strong and it weighs so much, and it being filtered through those kidneys over time could cause chronic kidney disease. Then you have some cases where they're a little bit healthier patients, and this is just their first time going through all of this all together, and that chemotherapy hits their kidneys hard, and it hits it suddenly. The difference between acute AKI and CKD is AKI is a bit or possibly reversible.
Okay.
Because it's only like a short impairment on the kidneys.
Right.
So being that say you stop, say a patient gets a reaction from the chemotherapy, they get sent to the hospital, we treat those side effects, and then they're back out there. Now they have a choice of whether they want to continue their chemotherapy or not based off of the reaction from the first time, but primarily that's what it is. Once their labs are stable again, then
they're all
fine.
good.
Yeah.
Okay.
In some cases, not all, but yeah.
Okay.
But so with renal failure and chronic kidney disease, that could cause the kidneys to be permanently damaged, which means that the kidneys are not able to filter and work properly, which means that a lot of the wastes and a lot of cells that are bad for the body are retained in the body, and that could cause kidney cancer.
So all really tied in together. Okay. And I've also read up on how chronic kidney disease and cancer can actually go directly together. Can you explain how?
Chronic kidney disease and cancer can be related in different ways. One way is straight out the gate, directly renal cell carcinoma.
Okay.
So, which renal cell carcinoma is a cancer. That's a cancer cell from the kidneys. It's in the name, right? But indirectly or directly, it could cause CKD. And then being that CKD, from what I explained earlier, if you have chronic kidney disease, your kidneys are not able to filter properly, which retains the cells, and you can't get rid of those. So they're conversely the same. Not even the same, but they kind of create each other, if that makes sense. Okay. So you could have one and it ends up being the other, or vice versa.
Okay. So we know that we are discussing these two very critical conditions. One alone already causes, a lot of things to go on just physically with the person. So my next question would be, with a patient that has kidney disease and cancer, how do they usually present, from your point of view?
I see a lot of patients with fluid retention. So swollen legs, arms. A lot of patients are short of breath because that pressure is on their chest or in their bowels, or I see cellulitis. So when the legs are thin or inflamed and that fluid is not going anywhere, where is it going to go? It's going to start trying to peek through that skin. Yeah. So you're going to see a lot of red marks and bruising and open wounds that kind of leak a little bit. And then you have low blood pressure, shortness of breath, oh my goodness. And that's when you get into like the pneumonias and stuff like that, or fluid in the lungs, pleural effusion, stuff like, and it's really sad.
Yeah, I can only imagine,
Still, you have families that still want them to keep fighting. You see what I'm saying? And you're looking at this person. Yeah. This, not to say that we have to give up, but your last days, what do you want your last days to look like? Yeah. You know what I mean? Yeah. Do you want it to be in a hospital, or do you want it to be out with your family? You want to be home. Some people want to be home, and because their family is power of attorney, they have to stay at the hospital because they want them to fight.
Right. Yeah. And that's another lens to really look at things, because it's in reality, we don't all make it out. So that's like something that I don't think many people want to talk about, but it's something that,
that's important.
You have to add into it, because that's what comes when you having those conditions and everything. So I know that a lot of those watching, may want to know what the care team looks like, when they're in there and trying to fight this battle. So can you tell us a little bit of how that works?
The team is very important. You're going to need your oncologist, a hematologist. You're going to need your internal medicine, your nephrologist. You will need your pharmacist. Pharmacists, let me tell you something about pharmacists. A lot of people don't know they are very important when it comes to dialysis, when it comes to chemotherapy. Pharmacists are very important people in that hospital setting, or all over. Yeah,
right?
they are very important. They're not just, you know,
just hand out some medicine, right?
Yeah, they're not just handing. They have to really do the
know.
math on some things. Yeah, so a lot of times we don't know that some patients, we have to take their daily weight, right? If you have some patients on antibiotics or they're taking their chemotherapy, they need their daily weight, so they make sure that they're getting the proper dose for that patient. Because a 200-pound patient is not going to get the same dose as a 50-pound patient or a 150-pound patient. You see what I'm saying? Pharmacists are very, very important. Then you have your nursing staff, and you may need like a nursing navigator just for a mental health and support system, just in case. Failure to thrive, that's what they call it. And this is someone who can get up and walk but won't because they're not in the mood or they're depressed. Physical therapists are also in a plan of care. I'm gonna tell you why, because sometimes you can have metastatic cancer, right? And like the kidney cancer spread to the bones and whatever, and then some people can't walk anymore, so then they have to be retrained on walking, right?
So for any nurses watching, do you have any tips, study tips to just kind of prepare them for working with this patient population?
That's a good question. So the most important nursing tips I would say is, if you love this or if you love to serve, this is a great field for you. It's very important dealing with like kidney patients. Labs are so important. So if you study your lab values, just knowing the range, if you know your ranges, you in the clear, because you know what it is to be in range and you know what it is to be out of range, right? Like your hemoglobin or your hematocrit or your liver enzymes, your ALTs and ASTs. Those are very important labs to know. Dealing with oncology, dealing with hematology, dealing with nephrology, is really good to know all of your labs. I think that's the most important one, because, and signs and symptoms. Signs and symptoms are very, because let me tell you something, you don't have to know every vocabulary word in the book. You just need to know, what does this look like?
Right.
I see her labs. That doesn't look right. You know, you need to know those things.
Right.
And you need to be able to look at your patient and say, okay, something is not right. They're sweaty, they're clammy. That's not right. They're not able, their legs are swelling up too much. That's not right. Especially in continuity of care is very important. Nurses, just as much as you have to advocate for your patient, you have to advocate for you too. Continuity of care is that's two. Continuity of care is when you're pretty like the same nurses with the same patient consistently, right? So if we work 3 days a shift, or 3 shifts a week, you primarily want to be with the same patients, right? Because certain nurses will know if one day, like on Monday, right, you had this patient, they were fine. 2 days later, this patient is a little sweaty, clammy. This patient, her vital signs are not, they're not stable, and she doesn't have any history of any cardiac issues. That's something that continuity of care is very important. So you would notice what is going on with your patient. Assessing is so important. But other than that, you want to tell me the normal range of hemoglobin?
There's a male and a female.
Yes.
Okay, so I'm gonna say female. Female is lower than male.
Yes.
Okay, so I would say female 13 to 15, male 14 to 16.
You could even go as low as like 8 or 9 to
okay.
Yeah, because if dealing with oncology patients, you can go as low as 9. 7, you going to heaven.
Okay.
You don't want to
go that low. Okay.
But yeah, between 8 and 20.
8 and 20. So
yeah.
that's how you remember your hemoglobin, 8 to 20.
Male or female.
Oh, so that just
that'll
cut
it out. Yeah.
I like that. Okay.
Because it's hard to remember, man. Because it's true. Like males are usually higher or lower than women, and then the hematocrit is always 3 times the hemoglobin.
Because that's in the 45s.
Yes.
See, I still know something from studying for boards. I still know a little something. Okay. Period.
So I would like to leave you all off with some more tips and just words of encouragement. Anyone going through chemotherapy or dialysis or just becoming a nurse or being a doctor or whatever the case may be in the medical field, keep going, keep fighting, take care of yourself. This information that we're learning, you're learning it for a reason. It's not just to have a title on your back. It is to implement this, share with other people that you love and care about. This is to keep people out of the hospitals, you know?
Yes.
And even though you might be annoying or they might avoid trying to talk to you, you keep doing it. Yeah. You keep doing it because at this point, it's like, it's not that you're signing, maybe you are signing an oath, you know, but it's almost your responsibility. Why would you hold back information to people you love and care about? Take care of yourselves. It's so important. Yeah. It's so important. So yeah, keep fighting, keep pushing, keep trying, keep learning, and stay blessed.
So I want to personally thank you, Mya.
Oh, thank you.
I am so grateful that you came and you were able to talk to everyone about this very important topic. Whether you are dealing with cancer, kidney disease, or both at the same time, I hope that you really learned a lot from this video. And just comment down below, sending our thanks to Oncology Nurse Mya Gibbons.
Thank you.
And we'll see you next time.